5:30 in high definition continues.
The next phase of recovering from a heart attack or heart disease begins when you leave the hospital.
And a new study says a high number of patients are readmitted shortly after discharge. Why? Earlier I talked with Dr. Tim Malins about this in Your Heart and You. That new study suggests that one way for recently discharged heart failure patients to boost their odds of survival is to see a doctor within the first month after leaving the hospital. And Dr. Tim Malins, this seems like common sense to me.
Sure, it is common sense. The important part about it is that when people go into the hospital for heart failure or a heart attack, something has changed from where they are at baseline. And in the hospital, you end up with a lot of medications of where your things are changing, trying to get fluid off and things like that. And so as people tend to get better, they are discharged. But they're still on these high doses of medications. And with time, you can be over-diuresed or get too much fluid off, or the levels of these medications can get higher, and that's why it's too high, and that's why it's real important to see. And really the study looked at the personal doctor of the patient, whether it be the cardiologist or whether it be the primary care doctor, because they know the patient. And the people who either didn't see a doctor within 30 days or saw a doctor they weren't familiar with tended to do worse, had a higher risk of rehospitalization as well as death.
I'm curious, though, how common is hospitalization from heart failure, and is readmission also common?
Exactly. So it's common. So we see it as the population gets older and older. We tend to see more and more heart failure because we've done a pretty good job in this country of treating heart attacks and things like that. And some of the downstream problems are chronic heart failure, and most of them we can try to really keep them out of the hospital just with medications on an outpatient standpoint. Some people have to go in. And it's one of the most common admissions that we see, and the rehospitalization rate, the 30-day rehospitalization rate, is fairly high, and that's something the government's actually starting to look at and starting to cut reimbursements to hospitals based on this 30-day rehospitalization.
So there is an incentive for hospitals to really follow up with patients to make sure that they are following up with their regular doctor.
Yeah, true, and I think a lot of the hospitals are really working on that, and they're arranging follow-up with the patient, with either their primary or their cardiologist, hopefully within a couple of weeks, but ideally within a month.
Well, as always, the goal here is to keep the patient as healthy as possible and out of the hospital. Always good. All right, Dr. Tim Malins, thank you very much.
Thanks.
And if you want to see more Your Heart and You segments, go to our website, rochesterhomepage.net, and click on the News tab.